The drug Remdisvir has been known to help treat COVID-19 patients. It can cut recovery time significantly. However, the question arises, how much will it cost? And will South Africa be able to import it at a reasonable price? Joan van Dyk from the Bhekisisa Centre for Health Journalism has been looking at this. She joins us now. Joan, good evening to you. Firstly, what does this drug actually do?
So Remdisvir is an antiviral medicine, and it's been around since about 2009. It's actually never been used to treat anything. We've tested it to treat Ebola and other coronaviruses like SARS and MERS. And then this year in May, researchers thought, well, let's see what it does against the new coronavirus. And they found that it actually cuts recovery rates by about a quarter. So your hospital stay would be 3 days shorter, from 15 days to 11 days. What they didn't find is it had no impact on whether you're going to die from COVID at all. It's an interesting way that this medicine actually works. It interferes with the way that the virus copies in your body. When you get infected with the coronavirus, it actually hacks into a lung cell and starts making copies of itself from inside there. And there's something about Remdisvir that actually interferes with that process.
It's fascinating. It does seem there's a huge cost issue here. I mean, why does it seem to be so expensive?
It's expensive. In South Africa, it's actually far less expensive than it is in the US. The US is paying 10,000 Rand per dose for their version of the drug. In South Africa, we got a generic version of it through Cipla, but it's still not much cheaper, even as a generic. We're paying 950 Rand a dose, and you'll need a course of treatment of Remdisvir. You'll be taking between 5 and 11 doses. So that's more than 10,000 Rand to treat someone with Remdisvir. And it actually, the research that we have shows that it actually only costs 170 Rand to produce those 10 doses, 10 and 11 doses.
Why is there such a big difference then? I mean, we've had the pharmaceutical industry before facing certain accusations. Is this another of those times?
Usually they say that they're adding the cost of research and development into the costs. In this case, there was no research and development, so one could assume that it's a kind of a profit that they're adding on top of the cost of what it actually costs to make the medicine.
There'll be a huge pushback to the pharmaceutical companies over this, surely. I mean, and in the past we've seen with HIV drugs that South Africa's been able to, put enough pressure on the pharmaceutical companies to back down.
We know that at the moment the health department is actually in talks with the companies, trying to see just how low they're willing to go with this medicine. But the price is a very important metric in the story, because if the price doesn't change, it's likely that we might not get the medicine in the public sector. There's a subcommittee of the Ministerial Advisory Committee on COVID-19, and they have been looking at the medicine, and they actually decided that it might not be a good fit for South Africa if it's that expensive, because people in South Africa, people in hospital are staying the full 10 days anyway, because they want to get a full treatment of dexamethasone, a different drug which actually has been shown to slash deaths from COVID.
How do you see this ending, Joan? Are we likely to see this drug being used here? Do you think the pharmaceutical companies are going to be put under more pressure?
They're definitely being put under pressure by the department. People don't agree on whether we will get this drug for South Africa. But yeah, it's basically the advisory committee, the subcommittee has submitted their review, and they've been waiting for a response from the department now for some time. So it's basically a waiting game to see what happens.
Joan van Dyk, thanks very much indeed from the Bhekisisa Centre for Health Journalism.